All right, let's dive in. You hear that phrase from your vet, your pet has a hole in their heart. And immediately your mind goes to serious places,
Oh,
right?
absolutely. It sounds alarming, and, well, sometimes it really can be. But often when we talk about a hole in the heart in pets, uh, we're actually discussing a congenital thing, something they were born with.
A specific defect.
Yeah, typically it's what's called a ventricular septal defect, or VSD for short. It's basically an opening, a hole in the wall, separating the heart's two main pumping chambers, the ventricles.
And that specific defect, VSDs, that's exactly what we're unpacking today. This whole exploration, it's based on source material that you, the listener, shared with us. Seriously, thank you for sending these sources in.
Yeah, it's great stuff.
So our mission is to take that material and pull out the key bits about VSDs in dogs and cats. What are they? How do they actually affect pets? How do vets figure it out? And what can we do about them?
I have to say, I'm really curious about how just one simple-sounding thing, a hole, can lead to such different outcomes. It really is fascinating, and your sources definitely highlight that variability. At its most basic level, a VSD is just an abnormal connection between the left ventricle and the right ventricle.
Okay, so normally you've got the left side pumping oxygenated blood out to the body, right side pumping deoxygenated blood just to the lungs. But with a VSD, they're connected. So how does that mess up the blood flow?
Right, that connection causes what we call shunting. Blood takes a shortcut, flowing from one chamber to the other through that hole. And the absolute number one thing from your sources, the factor that really dictates almost everything else about a VSD, it's the size of that hole.
Ah, so it's not just that there's a hole, it's really how big is it?
Exactly. Size is definitely the most critical factor. Think of it maybe like a leak between two pressurized rooms,
Okay.
a small VSD that's like a tiny crack. It's restrictive.
Meaning it restricts the flow?
Yeah, there's high resistance across that small opening. The pressure difference, high pressure in the left, lower in the right, mostly stays the same. Blood mainly shunts from left to right, an LR shunt.
Mm.
And here's one of those surprising things your sources mentioned. That very restricted flow shooting through a tiny hole at high speed, it creates a really loud noise.
Wait, really? The small hole makes the loudest sound. That seems backwards.
It does, doesn't it? But it's that high velocity, that turbulence through the narrow gap,
Yeah.
that makes the loud, harsh, high-pitched murmur. Now, a moderate VSD, it's partially restrictive, so more blood volume shunts from left to right.
Okay, makes sense. And then a large VSD.
That's like having a big open doorway between the rooms. It's non-restrictive. There's hardly any resistance. So the pressures in the left and right ventricles start to equalize.
Whoa.
Yeah. And the shunt volume, initially still left to right, can become massive. That leads to some serious volume overload pretty quickly.
So size is definitely king here. Are there other things influencing the shunt?
Yeah, a couple of things. The location of the hole matters somewhat. Most VSDs in dogs and cats are what we call paramembranous. That usually means they're right under the aortic valve. And also, the relative resistances in the circulation play a role. The pressure needed to pump blood through the lungs versus the pressure needed for the rest of the body. That difference influences the shunt, too.
Okay. Let's stick with the most common situation for a minute. That LR shunt blood going from left ventricle to right. What happens downstream? What are the effects on the heart and the body?
Right, so with an LR shunt, you've got oxygenated blood spilling from the left side into the right. Then it gets pumped back to the lungs along with the normal deoxygenated blood.
So extra blood going to the lungs.
Exactly, we call that pulmonary overcirculation.
Yeah.
All that extra blood then comes back from the lungs to the left side of the heart, the left atrium and left ventricle. This creates a volume overload, specifically on the left heart chambers.
Because they're getting the normal amount plus the shunted amount back.
Precisely. And over time, that extra workload makes the left atrium and left ventricle enlarge. Their walls might thicken. If the shunt is big enough and goes on long enough, this overload can just overwhelm the heart. That's when you can get left-sided congestive heart failure, or CHF. Usually that shows up as fluid backing up into the lungs.
That sounds like the main worry with a larger VSD. Your sources mentioned an even worse potential complication, though.
They did, yeah.
Yeah.
It's less common in our pets compared to people, but it's called Eisenmenger syndrome. This is a really serious outcome. It happens with chronic, large LR shunts that cause that pulmonary overcirculation for so long that the blood vessels in the lungs get damaged and scarred.
Okay.
This leads to extremely high pressure in the lungs, severe pulmonary hypertension. Eventually, the pressure in the right ventricle actually becomes higher than the pressure in the left.
So the pressure flips.
It flips. And when that happens, the shunt reverses direction. Now, blood flows right to left, RL shunt.
And that means blood from the right side, the deoxygenated blood, it bypasses the lungs entirely.
Exactly. It gets pumped straight out into the body circulation without picking up oxygen. The result is cyanosis. You might actually see bluish gums or tongue because the blood isn't carrying enough oxygen.
Wow, that sounds really bad.
It is. It's a very grave sign, usually indicates an irreversible stage of the disease. Your sources do note that while it's uncommon in dogs and cats, if it does happen, it tends to occur quite early in life, not usually after years and years.
Okay, so the internal mechanics are pretty complex, but it all seems to circle back to that hole, and crucially, its size. Let's shift to the outside view. For someone listening, how would they even know their dog or cat might have a VSD? What signs should they look for?
Yeah, good question. And again, size is the key determinant here. For pets with small VSDs, the most common scenario is they show no signs at all.
Really? Completely normal.
Totally normal behavior. They run, play, eat just fine. The only sign, often, is that loud, harsh, high-pitched systolic murmur we talked about, usually heard best low down on the right side of the chest. These are often just picked up during a routine puppy or kitten checkup.
So finding a loud murmur isn't necessarily a disaster.
Not with these small, restrictive ones, no. In fact, the sources mention that some of these small VSDs can even close up on their own as the animal gets a bit older.
Huh. Okay, what about the moderate VSDs then?
With moderate ones, you might start to see some subtle signs related to that volume overload we discussed. Maybe the puppy tires out a bit faster than littermates some exercise intolerance. Or you might notice they're breathing a little faster than normal, even at rest, tachypnea. Or maybe seem to have slightly more effortful breathing, dyspnea.
Any other signs?
Coughing can occur, though it seems to be more common in dogs with heart issues than cats. And sometimes, especially in young, growing animals, you might see stunted growth. They just don't quite thrive like they should because their heart is working overtime.
Right. And the really large VSDs, I imagine the signs are much more obvious there.
Oh, definitely. Large VSDs typically cause pretty severe clinical signs, and they often show up early, usually within the first few months of life, maybe up to the first year or two. It's usually clear that something significant is wrong with these guys.
Like what kind of signs?
Well, you'd see clear signs related to that left-sided CHF, things like severe difficulty breathing or very rapid breathing because of fluid building up in the lungs, that's pulmonary edema,
Yeah.
a persistent cough, again, especially in dogs, marked inability to exercise, just general lethargy, weakness.
Poor appetite, too.
Yes, poor appetite, anorexia, weight loss, failure to thrive. In really severe cases, you might even see syncope, which is fainting or collapsing spells. And of course, if things progress to that RL shunt stage, you'd see the cyanosis, the blue tinge. Sadly, pets with large untreated VSDs often develop heart failure early and have a shortened lifespan.
Gosh, that's quite a range. From totally fine to critically ill. So how does a vet pin down that it's actually a VSD causing the problem, especially since, murmurs can happen for other reasons?
The diagnostic journey usually starts right there, with auscultation listening with the stethoscope. That classic loud, harsh murmur that lasts through most of systole, heard best on the right side near the sternum. That's a really strong pointer towards a VSD.
But you mentioned something interesting earlier.
Ah, yes. It's worth remembering, like the sources point out, that if the shunt has reversed to right to left, causing cyanosis, those animals often don't have a murmur.
Right, because the pressure difference is gone or flipped. So strange.
It is counterintuitive. So after listening, imaging becomes really important. Thoracic radiographs, chest x-rays are usually the next step that give you the big picture.
What can they show?
With a significant LR shunt, the x-rays might show enlargement of the left side of the heart, or maybe the whole heart looks big. You might see signs of that pulmonary overcirculation. The blood vessels in the lungs look prominent, or if CHF is present, you'll see signs of fluid pulmonary edema.
And if it's an RL shunt?
Then the x-ray pattern might look different, maybe right-sided heart enlargement and different-looking lung vessels. But it's important to remember, with those small asymptomatic VSDs, the x-rays can look completely normal.
Okay, so x-rays give clues, but maybe not the final answer. What else?
An ECG, an electrocardiogram, can be done. It looks at the heart's electrical activity. It might show patterns suggesting certain chambers are enlarged or pick up arrhythmias, but it doesn't actually let you see the hole itself.
So how do they see the hole? What's the definitive test?
That brings us to the gold standard for diagnosing VSDs, echocardiography. That's an ultrasound of the heart, usually done with Doppler.
Ah, the echo.
Exactly. The echo allows the cardiologist or radiologist to literally see the hole in the interventricular septum. Direct visualization.
Okay, that confirms it. And the Doppler part.
The Doppler is crucial. It uses sound waves to show blood flow. So it shows the direction of the shunt. Is it LR or RL? It measures the speed of the blood flowing through the hole, which helps estimate the pressure difference and assess how restrictive the VSD is. It helps estimate the volume of the shunt.
So it tells you how bad the hole is, functionally.
Pretty much, yeah.
Yeah.
It also lets them measure the size of the heart chambers, assess how well the heart muscle is contracting, and really importantly, check for any other congenital heart defects, because sometimes pets have more than one issue.
Like, what else might they find?
Oh, things like a patent ductus arteriosus, PDA, or pulmonic stenosis can sometimes occur, along with the VSD. The echo helps sort all that out.
Your sources mentioned something about spontaneous closure looking like an aneurysm on echo.
Right. Sometimes when a small VSD is closing naturally, the tissue patching it can bulge slightly, forming what looks like a little pouch or septal aneurysm. It's a sign of healing, basically. But vets also have to be careful because sometimes just the way the ultrasound beam hits the septum can create an artifact, a septal dropout, that might look like a hole when there isn't one. So expertise in reading the echo is key.
Makes sense. So echo gives the full structural and functional picture. Any other tests that might be run?
Usually routine blood work is done. Often it's normal, unless there are complications, like with that severe RL shunt. You might see a really high red blood cell count that's called erythrocytosis, the body trying to carry more oxygen. Or if the pet's in severe CHF, maybe kidney values might be affected.
What about those heart markers?
Yeah, cardiac biomarkers like NT-proBNP can be measured. High levels can indicate that the heart muscle is stretched or stressed, helping gauge severity. And then in very specialized settings, cardiac catheterization might be used. That involves putting catheters into the heart to directly measure pressures and flows, but it's much more invasive and less common for routine diagnosis.
Okay, so let's say the diagnosis is confirmed. You know the size, you know the impact from the echo. What happens next? What are the treatment options for a pet with a VSD?
Well, like everything else with VSDs, the treatment really depends heavily on the specifics. Size, signs, complications, it all factors in. For those small VSDs where the pet is totally asymptomatic,
The ones with the loud murmur but no problems?
exactly those. Often the best course is no specific treatment at all, just regular monitoring, checkups with the vet. Many of these animals will live a completely normal, happy life. And like we said, some might even close on their own, especially when they're young.
So finding a VSD doesn't automatically mean medication or surgery. That's good to know.
Definitely not for the small ones. Now, if the VSD is moderate or large and causing volume overload, or if the pet starts showing signs of CHF or develops pulmonary hypertension, then medical management becomes important.
And that's aimed at.
It's aimed at managing the symptoms and supporting the heart, making its job easier. It doesn't close the hole itself. We use drugs like diuretics, maybe furosemide, to get rid of excess fluid, especially from the lungs in CHF.
Okay.
Then there are ACE inhibitors, like enalapril or benazepril. They help relax blood vessels, reduce the heart's workload, and might even slightly decrease the amount of LR shunting. Pimobendan is a really useful drug that helps the heart muscle contract more strongly and also relaxes blood vessels.
What about the high lung pressure issue?
Right. If pulmonary hypertension is present, we might use pulmonary vasodilators like sildenafil, yes, the drug also known as Viagra, to specifically help lower the pressure in the lung arteries. And alongside meds, managing CHF often involves some activity restriction and feeding a sodium-restricted diet.
Okay, so that's managing the symptoms. What about actually fixing the hole itself? Is surgery an option?
Surgical intervention is an option, but it's a big deal in veterinary medicine. It's complex, requires highly specialized teams and facilities, and isn't nearly as common as it is for kids with VSDs.
What kind of surgery?
Well, the traditional approach is open heart surgery. They literally have to stop the heart, use a heart-lung bypass machine to keep the circulation going, and then surgically patch the hole closed. It's a definitive fix if successful, but obviously carries significant risks and is quite expensive.
Wow, yeah, open heart surgery sounds intense. Are there any less invasive ways?
There are, and they're becoming more available but still specialized. These are percutaneous closure techniques. Basically, they thread tiny catheters through blood vessels, usually in the leg, up into the heart.
Through the blood vessels?
Yeah, and then they deploy a special device, kind of like a tiny double-sided umbrella or plug, right into the VSD to block the hole from the inside. Less invasive than open-heart surgery, but still requires specialized equipment and expertise.
Interesting. The sources also mentioned something called PABI, pulmonary artery banding.
Ah, yes, PABI. That's considered a palliative procedure, meaning it doesn't cure the VSD. It's sometimes used in very young animals, like puppies or kittens, who have a really large LR shunt and are developing severe CHF very early.
And what does it do?
A surgeon places a band around the main pulmonary artery, the big vessel leaving the right ventricle for the lungs. This band intentionally narrows the artery, restricting blood flow to the lungs.
Why would you want to do that?
Because it reduces that massive pulmonary overcirculation and takes the volume load off the left side of the heart. It can prevent or lessen severe early CHF and basically buys the animal time, lets them grow a bit bigger and stronger. But it doesn't fix the VSD itself, and it creates a new problem, an obstruction for the right ventricle. It might need further surgery later or cause long-term issues itself.
Yeah.
It's usually a temporary measure or a bridge if definitive repair isn't feasible right away.
Okay, so quite a few possibilities, from just watching and waiting to pretty complex interventions. So what's the overall outlook? What's the long-term prognosis for a pet diagnosed with a VSD?
Again, it really hinges almost entirely on the size of the defect and its consequences. For small, asymptomatic VSDs, the prognosis is generally excellent. Most live normal lives. For moderate VSDs, it's more variable. Some might stay stable for years. Others might eventually develop signs of CHF later in life. Regular monitoring is key.
And the large ones.
For large VSDs, unfortunately, the prognosis is often guarded to poor if they go untreated, primarily because of that risk of early severe CHF. Medical management can definitely help manage symptoms and improve quality of life, sometimes for a good while. Surgical or interventional closure, if successful, can significantly improve the outlook. But it remains challenging, especially if severe pulmonary hypertension or that Eisenmenger's reversal has already developed.
And since this is something they're born with, you mentioned genetics earlier. What about breeding?
Yeah, that's a really important point from the sources. VSDs are considered heritable. The exact way they're inherited might be complex and vary between breeds, but there's definitely a genetic component. So the strong recommendation is that animals diagnosed with a VSD should not be used for breeding.
Makes sense. Responsible breeders should be screening.
Ideally, yes. Responsible breeders should be aware of congenital heart issues like VSDs in their lines and potentially screen breeding animals, maybe with auscultation by a vet or even echocardiography in some cases, to try and reduce the incidence.
Okay, so let's try and wrap this up. The main takeaway seems to be ventricular septal defect, that hole between the heart's main pumping chambers. It's a common thing pets are born with. But the absolute game changer is the size of that hole.
Absolutely. Size dictates everything, whether there are any signs at all, from none to severe heart failure, and ultimately the prognosis.
And diagnosis hinges on hearing that characteristic murmur, usually loud on the right side, but then really relies on imaging, especially that cardiac ultrasound, the echo, to see the hole and figure out its impact.
That's right. And once you have that information, the path forward, whether it's just keeping an eye on things, starting medications to manage symptoms, or considering a specialized procedure to close the hole, that decision is totally tailored to the individual pet, their specific VSD, and how it's affecting them.
Right. So considering just how incredibly variable these VSDs can be, from that surprisingly loud murmur in a perfectly healthy-seeming puppy to a really devastating, life-limiting diagnosis in another, what does this deep dive, based on your sources, really tell us about just how vital those routine vet checkups are? Those visits where something like a potentially harmless but definitely noticeable murmur might be the very first clue, something to think about for your own pet's health journey.